Do well to introduce yourself. Tell us where you're watching us from. I'm Health Educator Mike by HED Mike. Um, a channel that is always focused on health promotion and disease prevention. We campaign life and also I may live healthy. A lot of things. If you haven't don't join us before now, or you are joining for the first time, you do well to subscribe to our channel and also turn on notification. We have actually discussed a lot of things on this channel. All right, other things that will help you improve your health and also help you prevent some to help you live a healthier life. So in this channel, um, our goal remains um, very simple. All right, taking a healthy living to a global scale. That is our goal on this particular channel. Right. So yesterday we started a discussion on diabetes insipidus, right? And we differentiated between diabetes mellitus and diabetes insipidus, which we see that of mellitus have type 1 and type 2 and have its own explanations, and it's all about problem with glucose, right? The diabetes um, mellitus is issue with glucose level, all right, but the diabetes insipidus is all about water excretion from the body. All right, we say that diabetes insipidus is a condition in which the antidiuretic hormone, the hypothalamus fail to produce antidiuretic hormone, or the kidney fail to receive the signal of antidiuretic hormone so as to make it to retain water. So in that case, it will excrete the water more than necessary, all right, leaving the body without water. So the symptom with that of diabetes mellitus sometimes can be similar, all right, especially that of polydipsia, which we say is polyuria, all right, and polydipsia, all right, which we say polyuria is excessive urination, right, and polydipsia is excessive thirst, right, feeling of thirst always. So the symptoms are similar, but they are not the same, right? It's a totally different thing. So diabetes insipidus is all about antidiuretic hormone. And what is the function of antidiuretic hormone? Antidiuretic hormones tells the kidney to reabsorb water when the body is processing urine, right? When the urine formation, all right, the process is going on, the antidiuretic hormone will tell the kidney, this water we need some, and the kidney will reabsorb some back into the body, all right, excreting the other. But in this case of diabetes insipidus, you discover that the kidney is removing water more than necessary, right? Diluted water that does not have enough concentration, no reasonable materials in it. So that's what happened in diabetes insipidus. Of course, we mentioned a lot of different type of the diabetes, right, released from the pituitary gland. Um, in that of central diabetes insipidus, the hypothalamus fail to produce antidiuretic and breaks down the all right. So I say, of course, of central diabetes insipidus, there are many things that cause that. It could be a tumor in the brain. It can be a sort of brain injury or even surgical procedure that have happened to that have carried out in the brain before. All right, it can be as a result of infection. It can be as a result of autoimmune disease. Right, brain infection or autoimmune disease can cause that central diabetes insipidus, where the hypothalamus fail to produce ADH, antidiuretic hormone. Of course, if it's not produced, I know how it's going to be released for it to do its work. Now, in that of nephrogenic, all right, which we say that the kidney failed to receive the signal of ADH in order to work fine. In that case, what happens is that nephrogenic diabetes insipidus, it could be a high level of sodium, all right? High level of sodium also can cause the kidney not to be able to receive that signal. All right, so that's what happens. It can even be high level of calcium. All right, hypercalcemia. All right, can still cause that nephrogenic diabetes. And that of a as gestational. What we discussed, just a recap. Yesterday we mentioned that and also have hypernatremia, which is what high level of sodium. There are the key signs to show that someone is having this diabetes insipidus. But just like what I mentioned yesterday before I ended my live streaming yesterday, I say all these things I mentioned, probably other things may still be the cause. So we are going to discuss about the diagnosis, then we discuss about the treatment and also the complications. That's what we're going to discuss today, right? Now, today, we are going to start with the diagnosis. So how do we now know that this particular uh, issue here, this polydipsia, this polyuria, this nocturia, this hypernatremia, how do we channel it or agree that it is because of diabetes insipidus? Number one is urinalysis, right? You are going to do urinalysis, or you can say urine analysis, anyhow you may like to call it, but it's a way of analyzing the urine to know the contents of that urine. And this thing is going to check if the level or the concentration of that urine, right? If the concentration is low, right, which is to say that it's diluted urine, means you are having diabetes insipidus, because is the concentration of urine, there's supposed to be some constituent, some electrolyte contain the urine to some extent, or to to a certain quantity. But if it's too dilute, means it's made up of more of water, means you are having what? Diabetes what? Insipidus. And if the specific gravity is low, also is showing that what? You are having diabetes insipidus. Number two that we're going to mention is serum lab test. All right, using your blood, they will get the serum to check, do a lab test to know if you're having the diabetes insipidus. And on that one, if you have high level of sodium, which you say is hypernatremia, of course, is a sign that is showing that what you have this diabetes insipidus, because it's going to retain the sodium as you are excreting the water, all right, out of the body. The sodium will remain, all right, so there won't be enough water to dilute the sodium. So it will make the sodium level to go high in the blood, all right, leading to this that of that of potassium, all right, check it in the blood and also in that of urine. So now in that serum test, you discover that what it will have what high osmolality, all right, which is to say that all this electrolyte is higher, is concentrated in the blood. None or even very few of them will be seen in the urine. All right, so it's telling that what the urine is passing out, what is going out of the body is just more of water. So you are losing a lot of water. So the blood is being choked with all those electrolytes, sodium, calcium, and so on. All right, so that's what happens. So if you do serum lab test, you discover that the osmolality level will go high in the blood. Please take note, in the blood, right? And also that of sodium level I've mentioned will go up. Now, and that is what urine osmolality. Of course, if you check the urine osmolality is going to be low if you are having diabetes insipidus, because of what's the osmolality, the concentration of all those electrolytes, right, in a particular solvent, or less in the urine or in the blood, or what is as in is checking what the level of what the concentration of all those electrolytes in a particular place, what's the quantity. Now if you check it in the urine, right, you discover that it's very, very low, means it is going to be in the blood. So if the osmolality of the urine is low, means you may be having what? Diabetes insipidus. Now, there's another one we are going to discuss again. We call it water deprivation test, which we are going to use as gold standard. If you hear gold standard, it means the best procedure or the best test ever, or the best, the most recommended one to use, right? So now when it comes to health system, now the gold standard of this test to know if you are having this diabetes insipidus or not is checking both the osmolality of the urine and the blood at the same time. All right, when you discover that that of the urine is low, all right, and that of the blood is high, means the person is having the diabetes insipidus. Please take note of this. There's another one we call a desmopressin challenge. Desmopressin. What is desmopressin? Desmopressin is a synthetic ADH, antidiuretic hormone, all right? It is let's say is an artificial antidiuretic hormone. All right. So when you check osmolality again, all right, they will check the osmolality. So now, if the osmolality of the urine is showing that what is concentrated, means it is central diabetes insipidus. All right, just like I said it's a synthetic antidiuretic hormone. So it's saying that what is just like a supplement to that antidiuretic hormone that is not produced by the hypothalamus. So when you take it in through intravenous, oral, or any way, all right, of using the desmopressin, it is going to bring about the work of this antidiuretic hormone, all right, even though the hypothalamus did not produce, so it's going to supplement it and do the work. So use this desmopressin and still check the urine osmolality and discover that this time around is now concentrated, so which is to say that you have corrected the condition, means what you are having is what we call central diabetes insipidus. And when you use that desmopressin and the concentration still remain diluted, which is to say that there are no changes, means what you may be having is nephrogenic diabetes insipidus, because in that one, even what happens. So those are just the ways to diagnose this diabetes insipidus, to know if really you have the diabetes insipidus or not. Now, the next thing we are going to discuss is treatment, right? Treatment of diabetes insipidus. And please pay attention. Once you get this video, share it. Make sure other people get to know more about what we are doing here. It's going to go a long way in helping us to grow and help us gain more visibility and help the world to live a healthier life. Now, when it comes to treatment, let's take it one after the other, starting from the different type of the diabetes insipidus. We are going to start with central diabetes insipidus. If you want to treat central diabetes insipidus when confirmed, the best way to treat desmopressin. Desmopressin, just like I mentioned, I say is a synthetic antidiuretic hormone. So using the desmopressin, it is going to supply this antidiuretic hormone function, all right, to the kidney, and the kidney will play its role by reabsorbing water, making sure that you don't excrete water more than necessary. All right, so the best way to treat central diabetes insipidus, which we say is a result of the hypothalamus failing to produce antidiuretic hormone due to many issues like the brain injury, like a surgical procedure carried out before now, or even tumor in the brain, or infections of the brain, or autoimmune disease. All right, so to correct that, use what we call desmopressin. Now, if you are treating nephrogenic diabetes insipidus, what you are going to do is that you are going to treat the cause. All right, what are the cause? Right, is it because of this kidney disease? You treat it. If it's a result of some electrolyte imbalance, you take a supplement to make sure that what the up, all right, instead of taking this desmopressin. If you take desmopressin for nephrogenic diabetes insipidus, it's not going to do any work, right? Because even if antidiuretic hormone is available in nephrogenic diabetes insipidus, still it's not going to receive the signal for it to reabsorb the water, right, making it possible for the body not to lose much water. So that's what happened. Now, in that of gestational diabetes insipidus, you are still going to use desmopressin. Did I say so? You are going to use desmopressin because of what this desmopressin, which is a synthetic antidiuretic hormone, is resistant to the enzyme that is produced in the placenta. Of course, placenta, I say it produces enzymes that breaks down antidiuretic hormone that is produced by the hypothalamus. All right, and when it breaks it down, it's not going to function, therefore making you to have diabetes insipidus. But this synthetic ADH, all right, which we call desmopressin, all right, synthetic antidiuretic hormone, which you call desmopressin, is resistant to that enzyme that can break it down. So if you're having gestational diabetes, you can use desmopressin and handle it, and you see that it's going to work properly. All right, it's going to work well, helping the woman to kind of carry her pregnancy term the right way, living healthy and so on. So now, for all of these, diabetes insipidus, is actually important. Let there be sufficient water, good water that is always available, that the person will need, all right? Because as the person is excreting excessive water, it's important the person replenish the water at once to avoid dehydration, all right? So to avoid excessive loss of water. So when you lose excessive water, discover that a lot of electrolytes in the body, it will stay high, like calcium level will go high in the blood, sodium level will go high in the blood because of the water that have been lost. All right, there's supposed to be water in the body to dilute them. All right, so that you function properly. So if there are not enough water to dilute them, you might have electrolyte imbalance. All right, before you know, you see irregular heart rhythm will come in, maybe bradycardia or even tachycardia, right, will come in, right, which is um, high this heartbeat and even low heartbeat will just come. It will sometimes become irregular, right, and before you know, complication have set in. So please, in any way or anytime you discover such an issue, right, you are having this symptom of this diabetes insipidus, please do well to seek medical help. Now, what are the complications? What are the complications that shows that um that you did not treat, or maybe what are the complications, what could be the outcome of not treating this diabetes insipidus? Because you just take it as something normal. Okay, since it's not diabetes mellitus, let me forget about this one, no problem. I'll check my sugar level is fine, is okay, so I don't have any problem. It's actually important that you seek medical help. If you did not do that, there are things that could happen to you if you are having the diabetes insipidus. Number one is severe dehydration. Severe dehydration. If you did not treat this diabetes insipidus, you are going to have severe dehydration. All right. With this severe dehydration, you discover that a lot of cells will not function properly. A lot of things will go wrong in the body because the body needs the water to function. Right, the cells need the water to function effectively. So you are going to have severe, very severe dehydration. So that's what will happen if you did not treat it as soon as possible. The next thing is what we call high sodium. Right, if you did not treat it, you are going to have high level of sodium. Of course, you're having high level of sodium, a lot of things can happen to you. Your blood blood pressure can go high. All right, so um you need to take note of that. It can lead to other heart diseases, right? If your blood pressure goes high, it can lead to other heart diseases. It can even end in stroke and other issues in the nearby future. So it's actually important to correct that diabetes insipidus on time to avoid complications. Now, the another thing I'm going to mention as a complication is that it can lead to shock. Right? So by not treating this diabetes insipidus, it can lead to shock. It can lead to, what is shock? Shock is when there is a blockage to the flow of blood to some certain areas, especially that part of the brain. All right, and when you begin to experience that shock, before you know it, a lot of things will go wrong. It can even lead to brain injury. All right, it can lead to depriving of the brain of normal nutrient and even oxygen that they need, that the brain need. All right, so before you know it, complication are setting. So it can lead to shock if you did not treat this diabetes insipidus as soon as possible. The next thing, it can lead to was seizure. All right, the diabetes insipidus can lead to seizure. It can lead to brain injury. All right, so that's what diabetes insipidus can cause if you did not treat it. Of course, all those things we've mentioned, this brain injury, seizure, shock, severe dehydration, even high level of sodium as the complications, of course, they are significant enough that's supposed to make you to do what, to seek medical help if you're having diabetes insipidus, so that it will be corrected. Because failure to do that this excessive urine excretion, don't just take it lightly. Don't take it as it's just a normal thing. Seek medical help. All right, talk to your healthcare providers so that you resolve it as soon as possible, because prevention is always cheaper than cure. All right, when you seek prevention measures, you discover that what will live a healthier life. So, and even if you have developed it already, you can actually try as much as possible to treat it as soon as possible to avoid further complications. So please do needful. If anyone have any question, you can put it on the comment section. I'm going to answer it anytime I receive a notification of the question. I will just answer you at once. This is Healthy Living Global, a channel that is always focused on health promotion and disease prevention. So we are always here to share the health tips with you guys. Do well to do your own part by sharing our videos, sharing our live streaming videos to groups where you belong to, and also those that would want them to benefit from this live streaming. We stream every day by 10 a.m. from Monday to Saturday, and on Sunday between 12 to 3 p.m. So we're always active and ready to give you what you need, necessary thing that you need to live a healthier life. I'm Health Educator Mike, and each time you want to contact me for any purpose, even if it's maybe consultation or anything, you freely just reach out to me 07088611262 07088611262. Reach out to me and tell me anything that you want, or ask me anything that you want to ask, and I'm going to answer you to see that what you live a healthier life. That is our goal, that is our mission, and that is what we stand to achieve on this health channel. Thank you guys for being part of us today. See you tomorrow by 10 a.m. for another live streaming. We still have other topics that we're going to discuss, a lot of things that we're supposed to discuss on this channel. Thank you, and see you tomorrow. Bye.